The topic discussed in our conference today is represented by the kidney disease. Discussions about kidney diseases can be presented in several conferences, as although their number is not very high, each requires special attention. If we were to talk about all the diseases, the conferences would need to last several hours. Before going into details, it is important to understand that our kidneys have a complex structure, and nephrons are those specialized structures located in the periphery area that are responsible for filtering the blood and producing primary and final urine. As a structural functional unit, the nephron represents the central component of our kidneys, while the rest of the internal organs responsible for eliminating urine are the urinary tracts inside the kidneys, where stones are formed. Therefore, a better understanding of renal functions is essential. Bowman's capsule, which represents the starting section of the nephron, has two layers, and the inner layer of this capsule, known as the Shumliansky-Bowman capsule, is responsible for filtering plasma from the blood. However, not all the plasma is filtered through this capsule. High dispersion proteins remain in the plasma, but all other organic substances, along with minerals, are filtered. Each day, both kidneys filter plasma to produce primary urine, and the average amount is 150 to 180 liters, sometimes reaching up to 200 liters. This amount would be represented by a 200-liter barrel in the garden, and the height of an average adult's kidneys is only 10 to 12 centimeters. Their thickness is approximately 3 to 4 centimeters, and their width is 5 to 6 centimeters. Our kidneys may be relatively small organs, but they play an important role in maintaining our health. Therefore, it is evident that kidneys are vital for our body. After filtering blood plasma into primary urine through Bowman's capsule, a large portion of organic compounds need to be reintroduced into the body. The process begins to be actively absorbed in the coiled channels, also called the proximal convoluted tubules. These convoluted tubules are responsible for reabsorbing approximately 60% of the water from primary urine, which also contains glucose, amino acids, small proteins, and electrolytes necessary for our body. At this stage, most of the substances required by our body are also returned. In addition, these coiled channels also excrete substances that are difficult to dissolve in the bloodstream, which are surrounded by capillaries. These substances include creatinine, uric acid, antibiotics, and salts. Almost all of these are returned to the primary urine due to their limited intake in the body. Next comes the loop of Henle, which is composed of two sections, a narrow and thin descending section and an ascending section. In the loop of Henle, the process of water absorption occurs mainly through passive transport, which means that the maximum and descending sections of the loop of Henle return up to 90% of water to the bloodstream. This process happens very quickly because it is crucial for maintaining the functioning of other organs of the body. Thus, the main function of these sections is to restore water. Beyond the descending section, there is the ascending section of the loop of Henle, which is primarily responsible for the process of restoring electrolytes back into the bloodstream, including potassium, sodium, calcium, chloride, and other electrolytes. They are critical for maintaining the balance of electrolytes in the blood, and the pH of the environment depends on their level. When we talk about active transport and active reabsorption, it is important to mention that cells in the proximal and ascending sections of the loop of Henle contain a large amount of mitochondria. These mitochondria allow for the active restoration of different elements in the form of organic or inorganic compounds in the bloodstream. If the ascending section of the loop of Henle does not function properly, electrolyte balance can be disrupted, usually leading to the appearance of symptoms and structural changes in the renal bundle structure associated with sand or stone formation. In the distal section of the nephron, namely the ascending section of the loop of Henle, selective or facultative reabsorption of sodium occurs in the distal convoluted tubule. This is due to active transport, again through the numerous mitochondria present in the cells belonging to the kidney covering the walls of this canal. The canal also plays an important role in the formation of the endocrine apparatus of the kidneys, although this does not apply to more than 20% of nephrons, as we have millions of such participating cells. Therefore, we can conclude that our kidneys are both universal organs of the endocrine system and our blood purification system. A small transitional zone is found where up to 9% of the body's water is reabsorbed through passive transport, so we have practically recovered 99% of the body's water. Collecting tubules are the first sections of the urinary tract and have their own source of origin. Here, 1–2% of the body's water is reabsorbed, but the main function is the elimination of hydrogen ions, which normally acidify the urine and give it a slightly acidic pH. In this section, a large amount of immunoglobulins and lysozymes are released, which confer certain antibacterial properties to the urine. Everyone has heard of urotherapy. In fact, the urine of a healthy person can be used to reduce swelling and promote rapid wound healing, which was practiced by our grandmothers and great-grandmothers. However, consuming urine, especially if you have kidney or other organ problems, can lead to the excretion of a large number of toxic products. We never recommend consuming urine, as everything our kidneys eliminate from the body is harmful. In general, if we talk about diseases, the disease associated with the kidneys is the impairment of mitochondrial structures. This can be caused by bacterial environments or many other diseases that can lead to the deterioration of nephron sectors. Kidney disease can be classified based on what is affected, such as glomerulonephritis or pyelonephritis. However, today we will talk about nephrolithiasis or urolithiasis, known as the disease with kidney stones, as time is limited and I don't want to tire you out. This pathology appears in the urinary system, specifically the urinary tracts, starting from the collecting tubules and the lower sections, which are canals with a muscular membrane. Any stagnation or disturbance of the electrolytes balance in urine can lead to the deposition of excess salts, forming flocculent formations in the case of sand. These can't usually be felt by a person, but in the case of inflammatory kidney diseases, they can form conglomerates, frequently in the kidney and bladder. His pathology is dangerous because it primarily burdens internal organs and reduces the quality of life, if it becomes chronic and sand or stones are formed constantly. The disease with kidney stones is dangerous because it is accompanied by complications that can lead to kidney amputation. The stone obstructs the urine flow from the kidney and practically leads to the damage of the renal parenchyma, making this kidney unsalvageable. Currently, there are new technologies available, and if hydronephrosis has started, then the kidney must be removed, and the second kidney takes on the function of increasing in size, cleansing the blood, but of course, the quality of life is affected, and there are many restrictions. In the case of hydronephrosis, a renal catalyst is now used, which is removed through a skin catheter to remove the accumulated fluid and begin treatment. At the same time, stones are crushed and removed, and nowadays, kidneys are not removed as quickly as they were 30 to 40 years ago. Regarding the predisposition to kidney stones, there is no clear statistic. This condition can occur in very young people under 20 years old and in adults, but it is more common in those over 50 years old. Women are more predisposed to the disease at a young age, with the average ratio being 1 to 7, while after 50 years old, kidney stones develop similarly in both sexes, but in men, it is usually milder, while in women, the stones are more massive, due to the particularities of the female body, and the condition is more complicated to treat than in men. This condition is more active and frequent among people in rural areas, mainly due to the ecological environment and water quality. However, the disease can become chronic and can have periodic episodes of recurrence, and if the cause is not removed and the diet and water consumption are not correctly followed, relapses can occur again. In addition, in some patients, even after the stones are removed, the condition can return if the doctor's advice is not followed. It is important to understand what can cause kidney stone disease. Scientists have shown that water with a high mineral content, such as mineral water, can trigger the deposition of these salts and lead to stone formation. In particular, water with a high amount of calcium salts is considered the most susceptible factor for the development of this disease, since there are various types of stones that differ in composition. In many regions, such as Siberia, it is not easy to give up meat in the diet and adopt a strictly vegetarian diet. In these cases, meat is the main source of food. In the case of kidney stone formation, there are several causes, among which excessive and long-term use of certain medicines that lead to salt deposition, genetic urinary system characteristics such as anomalies or narrowing of the urinary tract, and inflammatory processes such as urethritis and cystitis. Also, inflammatory diseases and metabolic disorders, including thyroid gland disorders, can contribute to the development of kidney stone disease. However, the most important factor is serious and regular dehydration of the body, which is a frequently encountered problem. Providing regular and adequate water to the body, even in the case of problems with the renal system, can help wash out unwanted accumulations in the body and urinary tract. These causes can act in a complex or isolated way and depend on the situation. It is important to recognize the symptoms associated with these problems to avoid complications. Renal pain manifests differently from pain in the subcostal region and can be confused with other conditions, such as hepatic colic. It is important to seek medical help in case of any symptomatology and to avoid complications. When we talk about the symptoms of kidney stone disease, i.e., kidney stone disease or nephrolithiasis, the first sign of kidney stone disease is always the sensation of colic or dull pain in the kidney area or in the urinary bladder if the stones form there. It is important to pay attention to frequent and painful urination, usually when gravel appears. The pain can increase to a serious level, and then acute pain appears or, as we say, renal colic. People cannot tolerate such pain, and usually changing positions does not relieve their pain. Patients feel very bad and cannot find a comfortable position. In this case, it is best to call an ambulance and consult with medical professionals to determine the size of the stone and whether it can completely block the lumen of the ureter to prevent the development of hydronephrosis. Painful sensations during urination and blood in the urine indicate that small stones have passed through and injured the lining of the urinary tract. This is the best scenario for kidney stone disease, where small stones pass on their own, and pain subsides after the patient urinates with blood, and no medical intervention is required. However, large kidney stones can lead to the absence of urine output or insufficient urine output. If a stone passes through one kidney, it can block urine output from that kidney to the bladder, so only one kidney will function, and the amount of urine output will decrease. Sometimes these processes are bilateral, which can lead to the complete cessation of urine output. This is already a very dangerous symptom, and medical attention should be sought immediately. Even in cases where blood particles in the urine are present, only 8% of patients may show this symptom. My mother had a stone that completely blocked her ureter and had to undergo surgery. The stone was removed successfully without removing the kidney, and ambulance services were contacted in a timely manner. Urine tests taken after the stone was removed and its blockage showed completely clean urine with no pathological processes. When kidneys become non-functional, degenerative processes begin that can cause secondary problems with the intestines, such as the production of openings and the formation of pus accumulations, which can lead to acute renal failure and even bacterial shock. If appropriate treatment is not followed, kidneys can atrophy, which is an extremely dangerous pathology that requires careful and prompt medical care to prevent the risk of death. Although people can live with one kidney, if that one kidney is affected, a kidney transplant may be necessary, as any kidney disease, not just kidney stone disease, can have complications that lead to renal failure. Kidney diseases usually lead to the development of acute renal failure, which can be successfully treated by doctors. However, chronic renal failure can still pose a problem, especially when looking for a young donor for kidney transplantation. Hemodialysis is currently an option to clean the blood when the kidneys do not function properly, but it can also have side effects. Inflammatory conditions or complications of kidney stone disease can affect blood flow to the kidneys, which leads to reduced blood flow. Reducing this blood flow can occur when vessels are compressed by stones, as shown in images of stones present in small and large calyxes, with most forming a conglomerate in the renal pelvis, which can lead to uropathy. Large stones in the bladder are very rare, but they can cause irritation and cystitis. Therefore, if you have symptoms, you should consult a specialist to investigate. Usually, even large stones that reach the bladder pass on their own if they have already passed through the ureter. Patients are advised to urinate into a container and check if a stone has been eliminated. If you have a predisposition and feel discomfort during urination in the bladder, collect urine for analysis, especially if you notice a small stone eliminated. The composition of stones can be different, so it is important to examine them to determine the type of stone. The images show stones that have been removed from the urinary tract. Note how different they are. Some are smooth, others have a different mineral composition. Apoptosis has certain reversible stages where the cell can be recovered, and ACTIVIDAN can help viable cells to restore their structure. In case the cells are destroyed by apoptosis, it is necessary to quickly generate new cells to restore kidney function. ACTIVIDAN increases the capacity of renal stem cells to regenerate, to quickly restore cellular connections and the transport channel, and to ensure complete kidney function. ACTIVIDAN manages different parameters of renal diseases and restores renal function through the use of renal stem cells. Although there are foods that can disrupt metabolic processes, including the endocrine system, ACTIVIDAN can restore other organs and systems that influence the formation of stones resulting from faulty metabolic processes. For example, pyelonephritis and other inflammatory kidney diseases or streptococcal infections in cases of agglomerative nephritis can be successfully treated by the use of ACTIVIDAN, which has a strong antiviral, antibacterial, and antifungal action to help the healing process. ACTIVIDAN acts primarily by reducing inflammation at the renal level and can be effective in any renal pathology, including vascular diseases or regeneration processes. Many consumers have reported benefits in treating nephritis and chronic renal failure, even in cases where the diagnosis was serious. ACTIVIDAN reaches the kidneys through absorption into the bloodstream through the digestive tract and helps to restore normal organ function and improve the quality of life in the case of any pathology. The product also has an anti-tumor effect and can be useful in the treatment of kidney cancer, as well as in the treatment of other conditions, including inflammatory diseases or lung infections. ACTIVIDAN has an important role in removing undifferentiated T lymphocytes, which can lead to autoimmune diseases and are often involved in diseases such as glomerulonephritis and renal calculi. In addition, by influencing the entire body, ACTIVIDAN is different from other drugs that focus only on a single organ or system. It is important to carefully read the information on the package insert and understand that dietary supplements are necessary only when medication use leads to vitamin deficiencies. I mentioned earlier that, at best, only 15–20% of the nutrients and food supplements we consume are absorbed by our intestines. Naturally, the lack of vitamin A, which is fat-soluble, can be a major problem. Vitamin A itself can be toxic, but carotenoids naturally transform it into a more easily assimilated form in the liver. It is important to be careful when consuming vitamins A and D, not to consume them in high doses to avoid serious pathologies. However, ACTIVIDAN improves the absorption of all nutrients and food supplements, including the B group vitamins which our bodies produce when we need them. This way, we will not have vitamin or mineral deficiencies, and our bodies will function perfectly. In case we consume food supplements and identify which substances we lack, we should consume them together with ACTIVIDAN to ensure optimal absorption and strengthen our overall health. Additionally, we must remember that we need to investigate the composition of kidney stones, regardless of their size, in patients with kidney stones, and maintain adequate hydration. Normally, a healthy person needs 50 milliliters of water per kg of body weight. Of course, if we weigh 120 kilograms, we will not be able to consume the total amount of water needed in a single day. Therefore, the average water intake is 1.5 to 2.5 liters per day. This does not include the soups, cocktails, or juices we consume, nor the amount of tea or coffee we drink in a day. We are strictly referring to pure water. Mineral water is not recommended because it contains many salts, which can affect mineral water consumers. Generally, mineral water is consumed in diets or 1 or 2 glasses a day. Those who have been to resorts can confirm that mineral water cannot be drunk without restriction in the resort area. This water must be drunk with a certain limit and cannot be used as a treatment for a large amount of 3 liters. Therefore, it is important to understand the difference between clean water and mineral water. I had kidney problems at the age of 14, and I was left with almost no kidneys, but I had enough judgment and education to refuse doctors to remove my kidneys. Currently, I have no kidney stone problems because I have properly and periodically removed sand and stones. I try to consume clean water more often than tea and to follow the water drinking regime. However, my kidneys need replacement, and my lifespan has been limited as a result. Thank God, I have lived to be 66 years old so far and hope to live at least another 25 years with the help of our ACTIVIDAN. For a healthy life, it is important to eat correctly, with an adequate ratio of protein, fat, and carbohydrates, to change our lifestyle and be more active, and also to drink clean water, not mineral water in limited quantities, but purified water. Drinking purified water prevents kidney stone formation. In addition, our ACTIVIDAN is an effective supplement for maintaining our health. There are no questions for me today, but thank you all for your attention and I look forward to the next conference. Goodbye.